good evening, everyone here. I am Rebecca Monsi, National Officer of Marketing and Sponsorship, and it is my privilege to be your host for today for the topic Telemedicine, Change in Medical Care in COVID time. First of all, I know you know the drill, but then just a few ground rules. Please keep yourselves muted at all times, video switched off at all times, and in case you have any queries, you can direct them to the host or the co-host, and we'll try our best to answer all of them. Now, moving on, we have with us today Dr. Saurabh Chawla, the CEO of the online consultation platform doctors.com. So, as Hippocrates has rightly said, declare the past, diagnose the present, and foretell the future. And that is exactly what Dr. Saurabh has been doing with his platform doctors.com, which is a comprehensive telehealth portal integrated with systems that help doctors to create digital prescriptions while having a real time conversation with the patient. Sir, it is a pleasure to have you here. So, diving right
Thank you,
into the
Rebecca.
topic.
First of all,
Yes, sir.
thank you very much for a wonderful introduction. So, first of all, I like to congratulate AMSA for, first of all, creating such a platform. It has been 10 years being out of a UG thing, and at that time, we used to talk about having platform in which students across the states, across the cities, medical colleges can join in. And what you people have been able to do, it's a commendable effort. So congratulations to the entire team, the founding team, the current operational team. Second, it has been a lovely experience interacting with you people since the conceptualization of AMSACON. Very methodical people. Hats off to you. So let's begin today's session.
Thank you so much, sir. And like you already said, let's dive right into the topic. So, today's topic telemedicine, changing healthcare in COVID times. Sir, so you have been in this field for quite some time. Would you like to tell us something about what exactly it is and where do we see ourselves now in this field of telemedicine?
Doctor, to begin with, I guess we have all only doctors are only here in this interaction. I guess
Right, sir.
it's not a
Right.
patient doctor combined. It's only doctor, right? So
It's
to
just
begin
doctors,
with,
yes.
anything, yeah. So to begin with, telehealth has been it has been a misnomer. You can say some people consider online video consultation as telehealth. Some people say any sort of telecommunication. Some people consider these lab investigations that are reported across cities, across states, the radiology thing. Reportings are done outside cities, outside countries even. So everything involves health, any sort of health service, which is being conducted or done across a digital platform. It is considered a health kind of thing, telemedicine thing. So it involves your video consultation. It involves all sort of reportings from the labs. It involves any sort of you can say these days we get consultations for these radiology people who are getting their CTs and MRIs that are in India from US, from UK, considering they have a very heavy caseload in those countries. So anything over a digital medium is into considered into medicine. And now we have a, you can say, as technology is advancing, now we have come up in a stage where we are you can say doing video consultations and all. Maybe in next 5 years you will be having devices which help patients to get themselves monitored. So we might have some sort of integrated services run by hospitals, so all the patients enlisted with them are directly being monitored from a central console. So anything that comes up in future linking our health over a digital platform will be known, will be considered in the ambit of telemedicine.
That is great to know, sir. And I'm pretty sure that all of us have got to know a lot about it because it's a relatively newer concept, especially in India. But I've heard that you said that you have worked in the rural settings also. So how has
Yes.
that helped you to come up with this concept? Like, what is the difference between working in a rural setting and an urban setting in India, especially?
See, working in a rural setup and urban setup, I'll divide it into two things. One is aspirations, and one is what we have at ground level. So aspirations of a rural and the urban patient are the same. They want quality healthcare. Now coming to the limitations and you can say pros and cons. Let's call it pros and cons. Uh, so some urban people have some, you can say, pros in the sense they have better availability of clinicians. So if you're sitting in a rural, if you're sitting in an urban area, so you will be having a lot of you can say clinicians practicing nearby. Best of the care is available in almost all urban areas. On the contrary, we have very few clinicians practicing in rural areas. From clinicians, I particularly want to convey specialists. So what happens is that for a person sitting in a rural area, visiting a clinician is a task. It is a task that that person has to travel. It is a task that person has to take a leave. He has to leave his daily course and everything, and then he visits the doctor. And if God forbid he is in a condition in which we need some sort of investigation, we could tell him that okay, you need to get a scan done or something from some other place. So the fellow then takes another day. He takes a leave. He goes again the next morning to the urban area, gets himself tested. Then the third thing is he has to visit the clinician again, and so on. Similarly, if he's a chronic patient, and he has to go for some sort of you can say medication like that for diabetes, for hypertension, or for some any other chronic problem. So what they need to do is they need to get their medicines from the urban medicine shops, urban medical centers. These things are not readily available at their local markets in the periphery. So for them, buying a medicine, getting that medicine, procuring that is a task in itself. And you need to understand, apart from doctor's consultation or any investigation fee that he has to pay, a burden of transport is included in it. Then for the rural patient, then there is another problem that generally if a kid or lady is involved, they do not travel alone. So they need some sort of, you can say, company from the home. Either two people are coming or three people are traveling. So you need to understand how much multifold the economic you can say economic pressure comes up on the rural household on basis of this. So another thing that I have seen in last 10 years is ignorance. See, in the rural setup, first, they are bound by certain customs and traditions. Certain, as you people who are in the third year or have done the third year, they must have written SPM or must have visited the rural households for their SPM practical work. You people must have come across that these people are bound by very strong community traditions, and over a period of time they follow those traditions religiously. They're very particular about it, and they don't have any logical basis of what's going on. So certain times you will come across if any one of you in future ends up being in a rural setup for some time, so you will see that they will come and they will give you their chief complaints. While giving the chief complaints, for example, if they've gone to chicken pox, then they will also tell you, okay, mata, I'm taking liberty of using certain Punjabi Hindi language here, ਮਾਤਾ ਹੋ ਗਈ ਥੀ ਤੋ ਅਸੀਂ ਫਲਾਣੀ ਥਾਂ ਮੱਥਾ ਟੇਕਣ ਗਏ ਸੀਗੇ, ਉਹਨਾਂ ਨੇ ਸਾਨੂੰ 3 ਦਿਨ ਕਿਹਾ ਬੱਚੇ ਨੂੰ ਨਵਾਉਣਾ ਨਹੀਂ ਹੈਗਾ, this and that and so on. Same is kind of things we face when we are doing the antenatal care. So that most of the people in our community or our country, I'll not say be specifically saying about rural or urban areas, everybody is, you can say, uh, crazy about having a male child. So and the moment the lady is expecting a baby, they start visiting here and there some baba and other person that he gives a medicine that there will be a male child, and they come up that okay, we didn't get the scan done, we didn't have the time. So as you are sitting in a summarizing it, as you are sitting in a rural setup, you will get to know that ignorance plays a big role. Then accessibility, lack of accessible healthcare plays a big role. Another important aspect here is, since there is a vacuum of quality healthcare in peripheral areas, there is mushrooming of quackery. There are registered medical practitioners. I'm not counting them into this. They are the people who are actually providing services at the ground level where uh, government has not been able to provide quality healthcare. But there are certain unregistered quacks sitting in periphery, and they are creating. They are, I will say, they are uh, uh, destroying the doctor-patient relationship. That uh, you can say the quality of doctor-patient relationship is being hampered due to activities of quacks sitting even in some part of urban areas and small towns, but moreover, we'll find that thing in the rural area. So as you said, how it contributed to the emergence of doctors.com. So a brief history in that, I was posted in a peripheral village, and at that point of time, my wife was doing her residency in dermatology. I guess she was in a final year, and there was a patient who came to me, and he was the skin was badly eroded, and it was something necrotized. So I didn't get what it is. Either it is cellulitis or some other sort of infection. So I just clicked a picture and I sent it to my wife and said, I asked her what kind of thing it is, what would you suggest me? So I was amazed to know that it was a fungal infection, and I had never seen such kind of fungal infection in my life. So fungal infection is a very minor thing, as we can. So I took brief history of the person. I realized that that fellow was having that condition for the last year or two. He was visiting some local, as I said, some quack, and I don't know what kind of steroidal combination he was being given, and that you can say accentuated the condition, enter into some, you can say, superimposed bacterial infection and whatnot, and he was in a really bad condition. So at that time, my wife was with the doing the residency, and I asked the patient to visit the medical college there. So after you can say 2 or 3 weeks, that person again appeared in the operation. And I asked him how's everything. So he told me that since he was so much misdiagnosed and mistreated by local quacks, his fungal infection is now resistant, highly resistant, and all the basic sort of medications that we provide do not work. And now he was on some higher antifungal, which was very costly, and he could not afford it. So he's not going ahead with the treatment. He says, "Okay, आप ਤੁਹਾਡੇ ਕੋਲ ਆਏ ਆ ਜੀ ਜੋ ਤੁਸੀਂ ਦੇ ਦਿਓਗੇ ਠੀਕ ਹੈ." So later on we arranged some samples for him, and it worked. So I got posted somewhere else, and I don't have, I'm not in touch with that patient anymore. But the basic concept that came into mind at that point was, see, patient was ignorant where to go. He was not having quality healthcare. So these two things, and further, he had, once he was narrating his story, he had all those problems कि मैं जा नहीं सकता, मेरे पास किराया नहीं है जी, मेरी दिहाड़ी मर रही है जी, my landlord is not allowing me, and so many things. And this is just one story. And similar stories are there for the antenatal care, where ladies fail to visit, you can say, for their regular checkups to a proper gynecologist, or even a proper, you can say, general physician. So this was the trigger point in which we decided that okay, now this is a problem in the society. And as an you can say, sometimes I'll say I'm entrepreneur at heart. So I was just looking into it. Okay, how can we solve it? So we came across certain platforms, certain business models that were going on, and then we tried to amalgamate them according to the Indian conditions in the Indian subcontinent. One thing I'd like to add more about the rural things there is that we are very lucky in Punjab, that here the villages are not actually villages anymore. They are small towns. They have all the basic amenities present. But if you look, you expand your vision to places in the, you can say, the Hindi, what we call them, the Hindi heartland, like UP, Bihar, and Madhya Pradesh, Chhattisgarh. The quality of healthcare at periphery level is very bad, and they are actually the people who are suffering a lot due to this quackery and other such problems.
I completely agree with you, sir. It's like a vicious cycle. It starts
Yes,
from, yes, exactly. It starts from poverty, and then it again leads to, it
yes.
just degrades down from there. So I think that's something all of us can look into as future medical professionals. We all can, this is something we can work for ahead in life.
Yeah, I guess it is more of the something that government needs to take initiative. But as doctors, I will only suggest or advise you people as upcoming budding doctors that you should just do your duty towards the patient with, you can say, full integrity. You should, I just say that do your job to the best level possible, and we cannot change much in the system because in the total healthcare system, doctors play a very small part. There are so many other components involved. But what we can do is serve the patient in the best possible way. And we should do that and should never misguide a patient. Just try giving the best possible health care we can give.
I completely agree with you, sir. I can't agree less. But I wanted to know that now that telemedicine, especially during these times, after the COVID crisis started in around March, uh, this has been a platform for a lot of, like, it's an emerging platform still, but then suddenly everybody started talking about it. So was
Yes.
it there even before, or it was not? It was there, but then it wasn't very prominent, or now it's starting to develop. How is it?
Yeah. So basically, what was before the COVID lockdowns? What was the situation before the COVID was? We are in business since 2018, and apart from the, there are many contemporary companies who are already doing this telemedicine thing in a different way. Some were only doing you can say teleconsultation over a phone call. Some were giving some sort of you can say chat kind of help on that patient can pay the money and chat with the doctor. So these were the things that was already going on. Mostly telemedicine was being used by clinicians or hospitals who were dealing with patients outside India. Now what the real problem was that there were no concrete guidelines by medical council, erstwhile medical council of India, or government of India about how to conduct telemedicine. And to you can say cherry on the cake was that there was so much misinformation available on WhatsApp and Facebook regarding telemedicine. So there was some uh, uh, indemnity case that happened in somewhere around 2017-18, I guess, in which a landmark judgment was passed against doctor and a heavy fine was imposed. So one component of that case was that uh, doctor had given advice over the phone call, though there were certain other elements in that case of negligence, but it was assumed okay. Now if you give consultation over a phone call, you are you can say putting yourself in trouble. You are not doing something according to law. So uh, doctors were not very comfortable with it. So once COVID came in, I guess it was really proactive. It was really a good part of the government. They acted very proactively in this, and they gave guidelines within a week. So erstwhile MCI and government of India gave the guidelines. So once the guideline was there, more clinicians were interested. So see, all the doctors were you can't, healthcare is something which is necessity. It is not luxury. Okay, you are sitting in lockdown and it's fine if you don't go to a doctor. There are people with chronic problems. There were expectant mothers. There were hypertensive patients, diabetics, who needed constant care from their respective clinicians. So once such a thing was there, the notification came out, and then more and more people. I remember it was the week there was notification. Around 500 doctors registered in the platform in a single week because they needed some sort of solution. They wanted to serve their patients, and they were looking for something that can help them in doing the same. So once notification came up, people started using it, and now it is steadily increasing. Even people who have reopened their clinics are still using it for their follow-up patients because it is easier for the patient. It is more convenient and comfortable for the doctor. Their chances of exposure to COVID is decreased. Unnecessary exposure for the patient is you can also avoid that unnecessary exposure for the patient. So everything you can people are slowly accepting and utilizing telemedicine.
So, sir, as this has a lot of benefits, But I want to know that how is it different from traditional medicine? Because my professors have always told me medicine is an art where you know interact with the patient, meet the patient. So how is it different that way?
How different is it talking to me right now than talking in person? Have my you can say, are my answers gonna change to your queries, or will they remain same? What do you think about that?
The answers will remain the same, definitely. But then I
But
meant
but
yes,
but once a doctor and patient is interacting, there is an important component of examination. That is what is lacking during video consultation, right? I guess that was the question.
yes,
So
sir.
what I wanted to convey with this my pre what my previous question was that, see, doctor and patient relationship is unique. It is based on faith. You can say touch, or you can say physical examination plays a very important role. It gives a high level of satisfaction to the patient. What telemedicine is, it is not something that who is going to, you can say, it will never replace the traditional medicine. It's an adjuvant. In an OPD, around statistically speaking, around 35% of patients are new patients and 65% of patients are old patients. So it is for those 65% patients who need their doses to be titrated, who need to know what insulin levels they need to go for, since either they have deteriorated or improved. It is for those cardiac patients who are sitting at home, who need not go for, you can say, repeated exposure in public transport, or need not sit in the OPDs. So it is a complementary kind of system in which traditional medicine is there. You cannot replace it. See, there are devices like, if you search, there are certain patents. Now there are stethoscopes, digital stethoscopes have come up. So maybe in future we are, as doctors, you might be having certain devices for, you can say, in your respective pharmacies for dispensing to patients. So you can just tell your patient, okay, take this stethoscope. So it is a very beautiful device. If you search it on the YouTube or you see in the Google, it is a beautiful patent. So if you take the stethoscope and place the diaphragm on your chest, it is a wireless stethoscope, small device, just the bell part of it. It tells you where to move your stethoscope. So at the particular point where it can, you can say, uh, uh, get that the best position for auscultate in the chest at that point of time, according to your body structure. It will tell you, okay, here I'm getting I'm receiving the maximum signal, and that can be transmitted through the digital platform, through the app, to the doctor, so he can hear your heartbeat. Okay, so these are things that are coming up. Definitely traditional medicine, it is going to stay. But yes, more and more devices, more and more, you can say, coming up with uh, you can, what I say, gadgets, more and more gadgets who can help you monitor the body parameters, the electrolytes, or any other things. Easier it will be for the clinician to do it over a distance.
Yes, so then now that the guidelines have also come out for the practicing of telemedicine, unlike before, so now I think more and more doctors are looking forward to this field, and even the patients will prefer this more because sitting at the comfort of their house, they get the advice, they get the consultation and the care that they need. But how do you see it? How do you see medicine being practiced post-COVID? Will there be more focus? Will we go back to the traditional way of medicine, or will we, like you said, will telemedicine still act as an adjuvant?
See, first of all, it's my personal opinion. I don't think COVID will go away even in 2021. So for me, COVID is going to stay till December 2021. This is first of all, this is my opinion. So second thing is that the way we practice medicine has already changed. See, now I know a number of people who are running their clinics. So ask every patient to put a PPE when they are entering the clinic. They sanitize, they get their hands sanitized, get them into PPEs. Doctors are sitting in PPEs, putting up their shields. Their staff is all in PPEs. They sanitize the area once the patient has, you can say, left the that waiting area and has moved to the inside the chamber or has moved into the procedure room. See, so the cost has increased multifold. So you have to provide PPE to every patient, to staff member, and whatnot. So considering all those things, clinicians are very much interested to go for telemedicine at this point of time. And this is gonna stay for at least 1 year. Now, once it is there for a year, I don't think that it is gonna go anywhere. See, it is both comfortable for the patient and the doctor as well. The cost, see, in a clinic, there is some cost involved when a patient visits your clinic. Either you are using PP or not, your air conditioner is running, you have a fixed amount of sitting, so you give appointments according to that. If you know that I have 50 patients lined up in a day for on OPD basis, and another 30 are being lined up in my e-consultation, so you are saving the cost for those 30 patients. So that is an important aspect that is going to be in the minds of the doctors. Secondly, uh, once we are doing a teleconsultation thing, we limit the time per patient. So it is more productive for the doctor. So for example, in the portal, doctor has the option. Currently, we have made a limit of 15 minutes per consultation. But in the next update, we are giving the option to the doctor that he can decide the time limit. So it can be 15, 30. A psychiatrist need or psychologists need a more, we can say, uh, duration of the slot. They are considering requesting somewhere around 1 hour minimum. So what happens is that you limit the time slot per patient, the time per patient. Actually, you are increasing your productivity, and nothing, you can say, no such thing like sometimes patient comes in and he starts narrating the story which has nothing to do with his you can say problem, and he will just narrate it, and he's wasting his time, he's wasting your time. You can't even tell him to stop here. Sometimes patient is done with his consultation and then he starts, you can say, chit chatting about something else. Some patients have that tendency, or they'll tell you that I have that relative, he's having similar problem. They have all set of questions which are not required. So by doing a follow up on telemedicine, we are restricting that unwanted call, and we are increasing the productivity. So all said and done, as more and more gadgets are coming up, who will be monitoring your health uh, on digital basis, it will be easier for doctor to monitor the patient's health over over an app or any system that the doctor gets developed, or a central console. Similarly, it is going to, we can say, benefit the patient. So it is going to stay. All said and done, it will stay. It will be adjuvant to begin with, but maybe in next 5 years, 70% of the consultations will be on basis of telemedicine. Mostly follow-ups will be there, or there will be patients who are sorry, yeah, please.
No, no, sir, continue, please.
Or there are certain patients who are sitting in, as we said, for example, someone is sitting in a smaller town and he wants to have a consultation with about his upcoming surgery with a surgeon in Delhi. So he can have a second opinion or take a referral opinion, and he can move there. So these are the things that post COVID, these will be the stress areas, the medical tourism thing, the advanced techniques that are available in metropolitan cities which are not available in small towns. So the patients will be trying, who are looking for, you can say, advanced techniques, and who want to have an opinion of, some people feel that surgeons in Delhi, Bombay are much better, and we want to have an opinion there. So all those people, this telemedicine is an important tool for them. It saves a lot of costs, and definitely it is going to stay.
I think it's like a dual benefit also for the doctors and the patient, because the doctors already have a lot of patient burden there, and India
Yes.
as a country itself has very few doctors as compared to the number of patients, even as quoted by WHO. So I
Yes.
think even that will that's a plus point. But now that we are a huge country with so many people, so many patients, and you did say that there are a lot of problems in the rural setting. So the patient to come to the doctor, then again he has to take a holiday and all. So that plays a role. But then in rural India, in most part of India, like you did say, the villages haven't developed so much that they can have access to internet. In a lot of villages, even proper schooling is not available. So access to internet is something that I think it will still take time. So how will telemedicine help the people there?
Uh, it's it's an interesting question. So I'll just like to tell you one thing here. If you look into the percentage of India that is being covered by internet, I guess most of the uh, villages at block level are having good internet in the form of Wi-Fi. And courtesy the telecom players and the fierce competition they are facing, we are having one of the cheapest rates of mobile, you can say mobile data, and one of the best possible networks available in at that infrastructure cost already in our country. So yes, this question was very much relevant in 2017 or 16, but post geo revolution that has come up, we are having good 4G connectivity, barring certain areas in you can say certain states like Jammu and Kashmir or few places in the northeast India. Okay, so even in those areas, we have concrete this BSNL already available, and they are providing good Wi-Fi in those respective areas since the bandwidth is not compromised in those areas for the BSNL. They are not sharing it with other operators, so they are providing quite a good internet. So that thing was a problem, but not anymore. Secondly, India is one of the largest consumers of Android devices after China. So anybody who is buying a phone these days, if he is a little bit, you can say, uh, what I say, if he's little bit, you can say literate, and he is picking up a smartphone. And the way the number, as you must have seen in last 2 months, the way Facebook, Amazon, and Google have invested in various telecom players, they have entered into deals. It reflects the potential that we are sitting on. So totally agreed with you. There must be certain areas right now which are having problem, but in next year or so, or maybe 2 years, I do not see any place in this country where we won't be having any place in this country where we'll be having certain connectivity issues. Another problem that is actually a problem is language. So everybody is not you can say comfortable with English, and according to data, around uh, uh, more than 50% of this country is not comfortable using English. They do not read, write, listen, or speak in English. So any app that we feel will be playing a big role in telehealth in India, they need to be having some sort of vernacular structure so that more and more people can get connected to it. For example, even if you see the growth of Facebook or WhatsApp in India, they were only able to have a meteoric rise once they entered into vernacular languages. Even we are coming up into 11 vernacular languages in, you can say, a couple of months. So language is a barrier that has to be crossed, and we need to understand that not everybody is having an email ID. So any app that is being created needs to work on the basis of a mobile number and not on the basis of email ID. I do not expect my maid to have an email ID. I do not expect people having anybody in the everybody in the rural India having email IDs. For example, once we started, once one user rang me up and asked me that I'm not able to enter use it. So I asked them, "What is your username? What is your user?" He said, "I don't know what is my email ID." Okay, then how did you enter it? He said, "I don't know." Okay, what phone are you using? He said, "I'm using an Android headset." Okay, if you're using an Android handset, you must be having a Play Store ID. That is why it is working. He said, "I don't know. Something was done by the person from whom I bought the handset from the by that shopkeeper." I was like, okay, now I can't help you if you don't have the email ID. So uh, anything to do with email IDs is not going to help in this country for the time being. And yes, language is going to be a big thing. So these two things need to be We have tried to, you can say, address these issues, but these are the things that I personally feel need to be taken care of by any of the companies who are, you can say, working to venture into this.
So, how far have we come as to breaking these barriers of language uh, by the use of vernacular platforms? Because most of the platforms that I
Yeah,
know till date are mostly in English, but a major part of the
yes,
population, I don't know how they'll access it then. Because they'll always need help from somebody else if they have to
yeah,
access the platform.
yeah. No, I just discussed this same thing in the last interaction we just had. And that is what I'm stressing upon. Now we are working on creating a platform that is available in 11 languages. So if you are using Hindi, तो आपको हिंदी में पता लगेगा, पंजाबी है तो पंजाबी में बताएगा, गुजराती है तो वो गुजराती लैंग्वेज में दिखाएगा. So we are coming up with that, and we are making a system in which email is not required. You just put in your phone number, automatically OTP will verify, and your app is running. You need not do anything, just like you use WhatsApp. So these are the things we are trying to address. Let's see how people accept it. It is only once it's in the market, but from the experience, from the case studies we have seen with social media, Amazon, as they started doing, they also did that. They gave the option of Hindi lately, I guess, couple of years back. So once we are also giving it, I feel people will be comfortable in using that.
And like you did mention before also, there have been a lot of devices now that are coming up which will help doctors in this to communicate with their patients via telemedicine. But as a country, do you think AI can be like how far are we from incorporating all that into our clinical medicine practice? Like when we become like how much time? I mean the timeline.
For AI,
Yes, sir. I mean, like any other device also to which will complement telemedicine. Like you did talk about the stethoscope, the digital stethoscope, which will send information directly to the doctors. So, is it being actually used in India? And if yes, if not, then how far are we from getting incorporating those aspects into our medicine practice?
see, we have a very, very, very long road to cover. Let me be very clear in that. Okay, for the question you asked about the stethoscope, the digital stethoscope, it is the Littman stethoscope. It's by Littman, and it is available in US already. I guess it is FDA approved, if I'm not wrong. So the uh, point here is that AI and devices are two different things. Devices just take your parameters and anyone can access them. With once you're talking about AI, artificial intelligence, it is that there is a central, you can say, software or system where the entire database is being integrated, and the data is being analyzed on various parameters. It's divided, segregated, and then AI understands, okay, if this set of problems is, you can say, this set of data is there, then the patient is having this kind of, you can say, ailment, and we need to go for such a kind of treatment. People are like saying that, okay, AI is just a few lines of coding is left, and soon we will have AI. Trust me, it's not going to happen so soon. It will, and in country like India, maybe 10 to 15 years. So once you people will be somewhere in your peak of the practice, it it may start giving something, some sort of, it may be giving some sort of, you can say, knock at the door kind of thing. But right now, do not expect anything. We have a vast road to cover. Even the devices that we are talking currently are, Apple was able to launch a pulse oximeter. They were working on this patent from last 2 years. Uh, what if you just go through various tech magazines or tech websites, you will get to know that now another patent has been taken up by these multinational companies, and it is for measurement of blood glucose levels transdermally, you can say, using some uh, sort of they transmit light, some sort of rays through your blood vessels, and they are able to figure out by the optometry, that what is the exact amount of blood sugar that is running in your body. So the first thing that might come up is uh, that blood sugar is being monitored, because it is one of the common things. We might be having portable devices that are, you can say, calculating our blood pressure. Already ECG is being done by certain devices. So if you go through the you can say the statistics about what kind of patents are coming up, blood glucose is the first thing, a small device measuring your blood pressure is the next thing, these two things. Then there are certain, you can say, electrolytes that scientists are trying to create some sort of there are, you can say, bigger large size devices are already there, but they're trying to get some sort of, you can say, trying to miniaturize the same so that they can be incorporated into existing, you can say, Fitbit kind of things, or wristbands, or Apple watches, whatever. So that portion will, it will take around 5 to 10 years for that thing to be available and for being commercially viable to a normal population. I'm not saying everybody, maybe middle class or upper middle class category people. So it will take time. On the part of the stethoscope, now that stethoscope, digital stethoscope that we're discussing, it costs around $800. So I don't think it is feasible right now for general population to go for it. But yes, with time, the costs will come down, mass production will come in at some point of time, and we all will be carrying it one day. So if you ask, 15 days, sorry, 15 years is what I feel that it will gonna take. And for AI,
Okay.
don't get worried that it will eat your practice. It cannot. It can only supplement. It can make your job easier. It will tell you, okay, the patient has this kind of thing. So as you see in the Iron Man series, Jarvis comes up and tells you, boss, this is there, and then he takes, the Iron Man takes the decision. Tony Stark takes the decision. So it will be like this for you. You are writing a you write chief complaint, so it will tell you, okay, these are the chief complaints. These are the potential diagnosis. These are different DDs. So you might pick up a DD, and then he suggests you, okay, these are the medicines that that clinician, 90% of the clinicians are writing, and these have these kind of side effects. Will you like to go for this medicine? It is giving this kind of side effect. Will you like to give something to, like, for example, it is causing nausea. Will you like to add some sort of anti-emetic into it? So these kind of, you can say, assistive kind of things can be there in medicine, and not nothing more than that. Nothing. Don't worry about it. I don't see in the next 15 years someone coming up as a robotic doctor sitting next to you and giving prescriptions. I don't think so.
I think we're still a long way, and we need to sharpen our own clinical skills rather than depend on other devices in India. If
You should,
that is right, what is
you sh-
saying?
you people should have the best skills available, and you should update yourselves enough that you can utilize those devices to the best possible level for your patients.
Definitely, sir. I think that is what we should all look forward to, right? Like we are becoming doctors so that most of us come into this profession with the same thought that we want to serve the society. So I think that is one of the major aspects of why most of us are here. And I wanted to also know that now when you're communicating with a patient online, so there might be connectivity issues, and like you did mention before, that every doctor usually the time is limited to 15 minutes, and in an OPD also it's almost like that. But again, if the doctor wants to talk more, then he or she can extend the time. But in case of connectivity issues, then again it kind of disrupts the rapport that is being formed. So does how can that be tackled?
See, we face this problem, and in our update, we have come up with an option that doctor can you can say, again, give a call to the patient. So I guess I had shared doctor tutorial and patient tutorial with you people. You can share it with your colleagues at the end of the session. So what basically we are doing is that the doctor and patient receive a call, just like a WhatsApp call, as you get a WhatsApp, or you can say a FaceTime call in the app. So doctor picks it up, patient picks it up, and they connect over that encrypted call. So what is happening is, in our next update we are coming up, we have provided a solution to this trouble, that okay, if doctor wants to have a word again, he can again you can say place a call, and same is for the patient. They both need to agree that okay, you can't just keep on pinging the doctor. You can't, you can say make an unwanted unsolicited calls to the patient. It is if the patient is agreed, it's simple. If there's some sort of disruption, both patients and doctor know that okay, there is you can say disruption has been there in, or there has been some connectivity issue. So they can just, you can say, log in again and can have a chat. They both will get a ring notification. So we have tried solving this problem, and trust me, 15 minutes. I have never seen a complaint apart from psychiatrists that 15 minutes has been a you can say a shorter time frame, because it cuts the crap. There is no you can say scope of unnecessary you can say discussions, and to the point things are done. Even patient knows that it will be completed in 15 minutes. Patient is very particular while explaining the disease, and the doctor is also, you can say, uh, they just discuss to the point. I have never seen a complaint from anyone on this issue. We have had more than you can say around 50,000 consultations per now till now, and in reviews there are different issues that people face, but this shorter time frame has never been a concern. So I guess 50,000 consults is a good number. So I'm pretty sure
Definitely,
with
sir.
that.
Definitely, sir. And I think that's a very comprehensive way also to look into it. Um, one of the questions that one of the questions that the participants also had was, now patient confidentiality, whether in an OPD setting or online, also it is very important. And now, as we're also seeing that there's so many cases of cybercrimes and cyberbullying, so how do you maintain patient confidentiality in such a scenario?
See, we are maintaining both confidentiality of the patient and the doctor. Neither the doctor has any contact information of the patient unless otherwise the patient is visiting in the clinic, nor does the patient have any, you can say, personal contact of the doctor. It is only the support that the doctor is providing within the app. So now coming to the data safety, we as a company are very much particular about it, and we are using encrypted video consultation partners. So our video interaction between the doctor and patient is hyper compliant, and it is encrypted. So it is the highest feature that is available in market currently, and we are taking care of this thing. There is no recording of this interaction at our end, though we are coming up with the you can say provision for the doctors for the sake of medical legal purposes, that they can record it and keep it in their custody. At no point of time the company is keeping any sort of that video consultation data. And as you mentioned, we also felt that patient data safety and security is paramount, and now we have devised a method in which maybe by end of this year we will not be storing any of the patient data even our end, though currently we are using encrypted and all you can say password compliant systems for servers for saving the data. But we have made a plan that just like WhatsApp, it's end-to-end encrypted, and WhatsApp doesn't know what you are talking. He only knows that you people are interacting. Similarly, we are trying to create a system in which whatever doctor and patient interact, whatever prescription or anything is being exchanged, we do not touch anything, nothing. It's between the doctor and the patient and nothing else. So what you are saying, it is really important. Confidentiality, patient security, they are very important. We are trying our level best, and we will continue looking for more and more avenues, more and more methodologies in which by which we can keep this doctor-patient relationship more secure, and they can have a, you can say, uh, they can have faith on us that we are handling it in the best possible way.
Thank you so much, sir. That's all the questions I had. But now the floor is open for questions if the participants have any questions. So there are a few in the chat box. I would read them out. So one of the questions that we've got is, so far, how good is the patient satisfaction with telemedicine in comparison to face-to-face interaction? I mean, in this COVID era.
See, patient Conducted a couple of surveys during this pandemic period. Last one was done in July. So see, patient is very happy. Even before the COVID thing happened, patients were interested that doctors take their WhatsApp calls, and doctors were not doing the same. As I mentioned, that there were no concrete guidelines. So once the guidelines were there, so any patient who is, you can say, having good access to internet, having good access to mobile, and is having some sort of trouble in visiting doctor, they are eager to use this service. So they are highly satisfied. It is a very small percentage of people who want to visit clinics who do not get a satisfaction, and any number between 5 to 7% is something we would have expected, that people love to see their doctors in person. So overall, if you ask me, patient is very happy. Had it not been, I would have not received the number of consultations.
Thank you so much, sir. And another question that has come is that we talked about language barriers and literacy issue also, and about telemedicine helping in rural areas. But for patients, these apps are very confusing and they do not have the knowledge to use this kind of technology. So how can that be tackled? Should it be advertised by the government or doctors or some telecompany?
It's simple. I guess user interface should be as simple as possible. And even the present version that is being run, that is available on Play Store and App Store, I feel that is for the more educated and literate people. Now we have come up with the update which I feel anyone using WhatsApp can use. So if a person is able to use WhatsApp or messaging service or a phone call over his device, something as simple as that we are trying to create, and I guess that will solve the problem. If the person can use WhatsApp, or if the person can, you can say, log into YouTube and watch videos, anything, even me or any other company who is doing this thing, the app should be as simple as that, and that will solve the problem.
Right, simplicity is all it takes to get that kind of outreach and to get people. So another question here was we talk about rapport and patient touch from doctors. So future won't it in the future won't it discourage the doctors to not take up service or rely completely on telemedicine, to not take up rural service or completely rely on telemedicine?
I, I guess whosoever has asked the question, he has mixed rural service with telemedicine. Am I correct?
I think that's what it is. They've
Can you
asked,
just repeat the question? There was some disturbance.
the question says, we talk about the rapport and patient personal touch from doctors. So in the future, won't this discourage doctors to take up rural service medicine, I mean rural service and rely completely on telemedicine?
See, telemedicine and rural service are two different components. You're mixing them. Telemedicine is a thing that you can you can for example, uh, you can just list yourself on the portal and you can help, or you can say you can serve anybody across the country. Rural service is something that is you can say government is actively taking care of that. They are providing you incentive for your post graduation exams. I guess 30% is provided. So uh, government has you can say has their own set of, you can say, goodie bags for you, and I think once you are out of your what I say undergraduation, you won't be having a clientele, you won't be having that kind of fan following. Only few of actively using maybe social media might be attracting crowd over digital medium. Everybody else will be trying to, you can say, establish themselves, and it will take an year or so. And government service, or you can say rural service, is taken by a few people who want to serve the society and take the benefit for their post graduation to enter into good institutes, or you can say government institutes. So these are two you can say these are two different genres. They don't mix anywhere. And once you are done with your PG, in certain states where government wants to press for rural service, they are going to have a bond or something. So that is a totally different aspect. So about telemedicine, if you want to stay in a rural countryside, if you enjoy or you are having a background where you have been from a rural, you might love staying in a rural area and telemedicine to urban people. You never know. So many people have left Delhi, Bangalore, Mumbai in the COVID area, COVID era, and have moved to their respective towns, and they are doing work from home. And their companies have told them, okay, stay there for next 2 years. We will pay for your Wi-Fi bill also. So you never know. You end up being in a rural area. You like that place. You like those sarson ke khet of kaun si movie thi DDLJ, and you give telemedicine to urban people.
Definitely, sir. So, keeping in mind the current scenario, there has been a lot of talk about violence against doctors. So, one of the participants has asked that can telemedicine serve as a better alternative to solve this problem of assault against doctors?
It, it is being used. In Maharashtra, certain ICUs are being managed over telemedicines. And what has happened there is, it was even before the COVID era, they certain, even the corporate hospitals have a central system of monitoring. So they keep one of their anesthetist or ICU expert there, and he monitors all the patients who are there in the ICU. So it's already happening. And definitely, I don't know, you people have the idea about it. Certain hospitals counsel patients. They take their they explain everything. Their entire consultation is being recorded, video recorded these days. So if your patient is in ICU, so the anesthetist or your attending clinician has to explain the prognosis or things are not going good for the patient. So everything is you can say done under videography, so that patient cannot the attendants cannot sue the doctor, or if in case some sort of you can say problem occurs up, they get some, you can say, local police or others who help, you can say, help in diffusing the situation at that point of time. So it is already being used. So what you are saying, that can it be used? It is already being used. So hopefully you neither of you end up in such a, you can say, a tough situation. But yes, it can be used. It is being used, I'd rather say.
Thank you, sir. And another question, keeping in with the legal guidelines itself, this participant wanted to know, like you did say that there have been guidelines that erstwhile MCI had given for practicing telemedicine. So, are there any specific medical legal guidelines that general practitioners should keep in mind?
Yes. See, one thing is that you need to have your record maintained. So any consultation that you are giving, you need to maintain that record for at least 3 or 5 years. It depends upon the state in which you are practicing. You should make sure that once you are giving the consultation, proper history has been taken by you and has been mentioned on that prescription sheet that you are giving. Similarly, for medicine, properly you can have to give the that thing, the generic name, the brand name, its duration and its frequency, like morning, evening, night, before, mid, afternoon. Everything has to be mentioned in, even in the app. We have that chart in that manner only. So everything that is being discussed with the patient has to be documented. Your medicines should be written in all caps. Everything that you people know, or you people must have seen these two prescriptions. You have to take care of all those aspects. Apart from that, in case when a doctor feels that it's an emergency situation, he needs to convey to the patient that it's an emergency and you need to see the nearest you can say referral center or nearest emergency hospital, whatever thing that is available to him. It should be documented. This is what MCI says. It says document it, and it says maintain the record. Apart from that, they have also prohibited you can say giving consultation outside India. So this is something that is dicey. Already some people are using and you can say giving consultation to patients outside India. We can't help in that. It is doctor's own choice. But these are the things that are already being in practice. Nothing much, nothing that. There is a
That
Gazette of India notification issued by Government of India on telemedicine. If you people Google it out, that guidelines of telemedicine by Gazette of India, Government of India, you can find the details there. It's a big, long list.
I think OPD or telemedicine documentation is the way to go about it. So,
Yes.
and another question was, like you said in the beginning itself, that you're an entrepreneur at heart. So, what is your advice to medical students to get involved in the development of such healthcare setup, such medical healthcare startup? How can we do our part?
First of all, I guess you need to complete your undergrad. Then you can decide if you want to be an entrepreneur or not. I'll just tell you one thing. It's this series. How shall I explain? It is a crown of thorns. Remember that thing. It's not for the faint-hearted. So if uh, it should not be the escape route, right? So if you feel that okay, मेरे से इस साल पीजी नहीं हो रही तो चलो मैं कुछ entrepreneurship वाला काम करती हूँ, it should not be like that. Okay, it should be you must have read something like dropout by choice. So it is something like that. If you're doing something like that, you should be really convinced what you're doing is right. For initial 1.5 year, I was considered crazy. It's not possible. People will have problem, this and that. So I have seen my set of criticism and negativity. So it's a tough game being entering into entrepreneurship. Currently, I'm somewhere in, you can say, at a point where I'll be getting a funding or I'll be moving the next ladder up. But crossing the initial, you can say, the first 100 doctors to be listed was the toughest thing that I had done in my life. So you want to do it, complete your undergrad, look for the passion, what you want to do. You want to do medicine, or you want to go into entrepreneurship. If you want to go into medicine, uh, you know how it works. People need to, you can go for a post graduation and super specialization. If you want to be an entrepreneur, okay, you need to first find out the problem. So for being an entrepreneur, you just need to know uh, what kind of problem that you can solve. If you have figured out the problem, then you need to know how can you solve it. And I guess before that, you need to validate it. Is it actually a problem that we are talking about? What percentage of people are facing that trouble? And if you find a solution, how much scalable it is. That is the biggest thing. So if your solution is not scalable, your solution is not commercially viable, sooner or later the project will go down. So first of all, find a problem, validate that problem, then go for solution kind of thing, what you think you can contribute towards society, and definitely you can move ahead. And if you has free time, I'll suggest you in your internship, if you are so much, you can say, pissed off with the old final study at that point of time, give 6 months to coding. It's the future. They are saying in ads these days. I have been, you can say, saying this from last, you can say, 2 years, that we as a country have failed to understand the importance of coding. So if any one of you has some person has some sort of uh, uh, you can say means by which you can learn it, so have a basic idea of what's going on.
Definitely, sir. And now, as we've reached to the end, just one last question: that how good is the patient compliance as in regard to treatment, the follow-up, and how is the prognosis affected in such? Sorry,
Sorry, I guess it was not audible.
sorry,
Can you
can you hear
repeat it,
me, sir?
please?
So
Can you repeat it,
the
please?
question was, how good is the patient compliance in respect to the treatment, and how is
It is jammed. The screen is jammed, ma'am. Doctor, the screen is jammed. Please repeat the question.
sorry, sir. The question was, how good is the patient follow-up, the prognosis as compared to, and the adherence to treatment as compared to the normal OPD setting?
Okay, so uh, Your voice was really broken. So after listening your questions from three different times, and I have got three different parts. So you want to know how prognosis and compliance of patient is different than the traditional. I guess that's the question, right?
Yes, sir. Yes, sir.
Hmm. Okay. Okay. So see, I should not be saying this thing on public platforms, and I expect everybody who is here is a doctor. So I'm taking this thing on you people. Patients are, uh, uh, I should not be saying this, but patients are highly compliant in nature. And as patients, you must, all of you who are listening to me are bad patients because everybody skips medicine. So either it is a telemedicine or it is traditional medicine. Compliance is going to be an issue, and it is something not you can say restricted to our country. It is a worldwide phenomena. So don't worry about it. Compliance is going to be equally bad. Unless otherwise the patient is in pain, he is not going to eat medicine. Till the person is having symptoms, the patient is eating medicine, he is a very good patient. The moment the condition is improved, the pain has subsided, the nausea has gone, or some other kind of symptom that person is having is gone, the patient will wean off the medicine eventually. They are not going to complete the course whatsoever. Even the best clinicians in the world do the same. So patient is always bad in compliance. So don't worry about it. You will have similar results.
So, as we are coming to the end of this webinar, I would really like to thank Dr. Saurabh on behalf of AMSA India and all of us present here. So, it was a really enlightening session, and a lot of us, I'm definitely sure that a lot of us have learned a lot from you today. And thank you for simplifying it so much. It was an honor having you here, sir. So, now
Thank
for
you.
the
Pleasure was entirely
participants,
mine.
yes, sir.
Thank you so much. It was, you can say, it was an honor being I had an opportunity having interaction with you, with your team. So thank you. So am I free to leave? You people can continue. How's it gonna be?
Yes, sir. We're done with the session. I just have to give them the QR code, and that's it.
Okay.
So for the
Thank you.
participants here, thank you so much, sir.
Good day.
So for the participants here, I'll be sharing the QR code on the screen right now, and you guys can directly scan it, and that is how your attendance will be marked for today. So be sure to do that, and then we'll also send in a form for y'all, which is supposed to fill, and I'll just share the screen. You guys can directly scan the code. And when you scan the code, you'll get the form directly through that.
I'm unable to scan the code. Can you help me?
Yeah, sure. How are you scanning the code? You just have to. Do you have a scan thing on your phone?
Excuse me, what is a sign-in picture?
So sign
How
in
to
is,
access the frame?
first of all, for the sign in picture question, sign in picture is you can click your picture with any of our filters and upload there, or you can click a screenshot of the session and upload the sign in picture. So if you're facing difficulties in scanning the code for iOS users, Apple users, you can directly click a picture. Click a picture, it will automatically show you the code. And I think somebody has already shared the form as well. If you're not able to scan the code, those who are in the session, then click on the form link and fill it. The form will only be open, stay open till 4:30 p.m. So please make sure to fill in the form and check in for the session today. Back to you, Rebecca. For the sign in picture question, answering again. So you need to click your picture with any of our filters that we have created for AMSACON. That is in the AMSA India's Instagram that you can find them. Or you can, if you're not able to do that, if you're assessing the session from your phone, you can click a screenshot of the session and then you can click a picture, sign in picture. So
Where are the Instagram filters present? I can't find it on on the Instagram page.
if you need to assess the Instagram on an app. When you'll open our profile, the filters will be present. The first part will show our posts. Second will show our IGTV videos, and the third part will show our filters. And then the fourth part will be, of course, for the tagged posts. But in the third part, you can find our filters. If anyone is not able to scan the code, you can find the link to the form. Somebody has shared in the chat box. But we'd recommend you to directly scan the code. You can even click a screenshot of this and you can scan it using, if you're using Google, you can use it to scan the code using Google Lens as well.